about control? Your normal cells have an order to their growth. Healthy cells. The cancer cells are erratic growth. Some terms you may have come across when you're dealing with patients. One is hypertrophy. That's cell growth that causes tissue to increase in size by enlarging itself. Not all hypertrophic cells are cancerous. Think of a male disorder where that it's not always cancer, but there's hypertrophy.
I know.
BPH, benign prostatic hypertrophy. Hypertrophy can be in the form of a uterine tumor. It can be neural, nerves, tumors that occur that interfere with the normal functioning of the system. Like, for instance, if someone had a benign tumor of the brain, not cancerous, but it definitely affects neural innervations of muscle or cognition. Hyperplasia, growth that causes tissue to increase in size by increasing the number of cells. You haven't had that many, but in clinical, you've dealt with women who have uterine hyperplasia. What happens with these individuals is the uterus becomes enlarged, the cells become enlarged due to. I'm glad you guys will join me.
There was some fortune. They closed the sleep. That did happen.
Don't go there. Hyperplasia, where the growth is so much that it interferes with the women start having back pain because of the growth of the uterus, or, for instance, they have problems that are hormonal, where there's dysfunctional bleeding. Then there's neoplasm. Neo means death. You have normal tissue that's normally growing, then all of a sudden there may be a mutation in a gene, and then there's necrotic tissue that occurs in that area. So neoplasm is damage to tissue that generally is irreversible. Characteristics of normal cells. Remember when you were in A&P and you have to know how to look at all these cells and look at it was in anaphase, telophase, or all this stuff. Okay. Normal cells have limited cell division. It's orderly. It's orderly. It undergoes apoptosis, all of those phases of cell division. Show specific morphology. You're going to see it's different with cancer. Have a small nucleus, and then the surrounding cytoplasm. They correspond to each other. Perform specific differential functions. That is our normal cells. If you were to look under a microscope at a slide cytology, you would know that those cells were cardiac, or if they were, say it was a mucosal of the stomach, you could tell by the morphology. Adhere tightly together. Cancer cells don't. And what we're going over now is the background in A&P. Because you're taking care of the patient, you're not taking care of the patient. Right? Other characteristics of normal cells are you will not have metastasis with normal cells because there's not a cancerous growth. You have orderly growth. Migratory would mean if something, there's a cancerous type cell that's growing and it migrates or metastasizes, goes through the lymphatic system or the bloodstream to a distant area. An example of this is normal cells. It's not going to do that. But if it was a cancerous cell, you might have in the throat some type of carcinogenic cell growing. It would then, through the bloodstream or the lymphatic system, migrate to maybe the lungs, okay, or further down GI. Okay. fairly well regulated manner, and they're together, but they're not clumping together and causing a hyperplastic condition. And the nucleus is well limits. Okay, benign. That's not cancerous, but it can still interfere with normal functioning, like we said, with prostatic problems. Benign has continuous or inappropriate cell growth. That's where you have the hypertrophy. Okay. But they look like their surrounding cells. If there was a cancerous growth on the prostate, you would do a cytology, and they take a deep tissue, surgically, and they look at the surrounding cells. If the surrounding cells, if they take a deep tissue, they'll look at the uppermost that they have on the slide, and they'll look at the bottommost. They want to differentiate if there's cancerous cells and normal cells growing at the same time. Have a small, now with benign, they have a small nucleus, similar to normal cells when they grow, and they form specific. So they're the same. Benign and normal cells are the same, with the exception there's so much hypertrophy that occurs that it interferes with the, say, if it was in the lungs breathing, if it was in the urinary tract, urinary output would be impeded. And there's not a metastasis. Okay? There's normal nucleus. Now, cancerous, like Rob said. What did you say, Rob?
Out of control.
Out of control. Out of control. Rapid, erratic, continuous cell division. It takes over the surrounding cells. For continual cellular replacement, they don't respond to normal signals. It's just so erratic, they have their own mind, those cancerous cells, and do not respond to the normal cells that are surrounding them. Anaplastic morphology, that means it's not like the sister cells that are all around. Have large nuclear cytoplasm. There's differentiated functions. They're not like regular cells that are there at all. And they migrate. There is some metastasis that is going on. Generally, it's through the lymphatic system, it's through the bloodstream. And the nucleus is so erratic. You might have one large nucleus, or you might have two in one cell. Normal cell on the left-hand side here, and then you have the cancerous cell. Not a lot of cytoplasm, but you have two nuclei here, and then the surrounding cells might have one, not looking like these, looking the same. Now, cancer itself, there are carcinogenics. Things that cause cancer. Let's start thinking of some that are in the environment. What are some things in the environment that promote cancer? Pesticides. Asbestos. They're all related. Respiratory. What about skin? Which
Sun.
Sun. Okay. Let's go to lungs. Besides the thing. Huh?
Smoking.
Smoking. Which ones can they change? The smoking. Okay. Let's go to with women. What is associated as a carcinogen with developing of breast cancer? Hormonal. What else? Huh? Genetics. Familial tendencies. There is a gene, BRCA1, BRCA2, I'm not testing you on that, but BRCA1, BRCA2 gene that's identified. And if one sibling has it, same mom, most likely there's a higher incidence of that sibling acquiring breast cancer. That's important for you to know because there are some people out there who will have to them, a prophylactic bilateral mastectomy because they don't want to get cancer. But what they don't realize is you still can get cancer to the surrounding tissue. But that's their way of thinking. So, let's go on down. Stomach cancer. Stomach and
Alcohol?
colorectal. What is associated with that?
Athlete, people who have GERD, that's not like the acid.
What she's getting at is irritation, continual irritation that never does not respond readily to medication management. If you have like an ulcerative change that's not responding well, and there's erosion of the GI mucosa, over time there can be a mutation that occurs, and it can be precancerous. Polyps that develop in the GI tract can be precancerous. Diet. What in the diet can predispose a person to cancer? Fat,
Alcohol.
high cholesterol, high fat, nitrates. What do we love to eat that have high nitrates? Hot dog. Mm-hmm.
Which
Okay,
means period.
and other smoked processed meats. Okay. Now let's talk about uterine, cervical or uterine cancer. What are the promotions there? What initiates those? Huh? Yes. Any type of, here again, infestation, viral in nature, HPV, where it has not responded to medication management. So, if someone starts early with their sexual activity and they're really active in it, they get HPV or other STDs, which causes the tissue to be eroded and it's in their immune system, so manifestations can occur over and over again, even though they've been medicated at one time with antiviral. That's a precursor for getting cancer. What else? Talk about women. Family history. Family history. There's a tendency there. So, we've said someone who is not abstinent, you can get it if you are not abstinent, but frequent infestation, viral infestations, STDs. What about elderly women? Same thing, hormonal, any type of activity there. What about men? What age group are we looking at when we talk about prostatic cancer that it's initial, some of the manifestations might be initiated depends where they work, right?
I thought it was like 65,
40s, 50s, around in there. Okay. Now, question.
One of my friends died at the age of 27 after he came back from Iraq because he was always in the sun and he developed skin cancer and he thought it was just like a mole and he died from that at 27.
Initially, cancer is not painful. It's when you really have that rapid growth of cancerous cells that it invades the tissue and affects function, whatever function that may be. Body system. It's in your latter stages of cancer growth, whatever the cancer may be. That's when the pain may manifest. Promotion. Someone's exposed to the sun. There is work-related and what have you. What's going to promote that cancerous growth is continual exposure. Some people are in the sun, they never acquire cancer. Okay? We're going to go over some of the preventative things here, but I'm just going over some of the stages. Progression is you're diagnosed with cancer, and there's some progression, even though there may be medical management. And metastasis is, let's say it's lung cancer, and the carcinogenic cells go into the lymph system. Or it's breast cancer, and it goes into the lymph. And what's the purpose of lymph, the lymphatic system anyway? To filter out. And if it's affected, you have those cells staying there. And you have new ones growing, further interfering with normal functioning. As stated, metastasis is extension into the surrounding tissues, blood vessel penetration. These are the ways that cancer migrates. And it releases the cells throughout the body. There's certain areas that it's the target where those cells are going to land. Invading is just that. It's invading because you have a means through the lymphatic system, the bloodstream, for it to invade. Local seeding, like for instance, if it's a GYN, gynecological type condition, and there is a carcinogenic cells that develop in the ovaries, what is the surrounding thing? What are the surrounding organs it can get to? Not only the ovaries, it can go into the tubes, it can go into that nexal area, which is all the area around the groin area, either side, and then it can invade highly vascular area down there. It can invade the uterus. Then you'll have someone who has to have a total hysterectomy and follow up with chemo and radiation. Okay. Bloodborne metastasis. What disorder are we going to be talking about on Friday, not today? Bloodborne. Leukemia. And lymphatic spread, as I've stated. Cancer classification. We will have a test question on this. Cancer grading and staging helps standardize diagnosis and treatment prognosis. Based on staging of the cancer, be it to the local area, which is in situ, you don't remember that, it's localized, or if it's spread to the lymphatic system or any surrounding organ. Distant organs, excuse me. Grading on the basis of cell appearance on cytology, and activity compares the cancer cell with its normal parent cell. In other words, if they look at breast tissue, they look at the cancerous growth. It's not the same, but that's the origin. Staging, there's two types of staging that we're going to talk about, but there's one I want you to remember, and we'll use some examples of that. Staging will give you like the examination, and as I stated, the metastasis. This is the one you won't be tested on, but just to show you, it's the G staging, where it goes from differentiating, poorly differentiated, undifferentiated, and the differentiated is, does this cancerous growth have any resemblance to the host, wherever it is? Is there differentiation? The lower it is, the better. If it's differentiated, that means that the person's not as, it's not that bad of a question.
No, I think they may want to look this over. I'm thinking that they may want to.
Yeah, they may want to look it over.
Just look it over.
That's on the test.
And the main thing was, if you have a question, Rob.
So, with when it's metastasized, that's when it has like that web.
It's gone.
It's web appearance, so it's not encapsulated, like,
Right.
so they can't actually get it out as easily. So that's why it's difficult to kind of get rid of the cancer. Is that
Okay.
Like-
Like if you had a cancerous growth and they say they're going to excise and take it out of the area, then
Yeah.
what are you?
well? Because the higher grade, they're unable to actually get the cancer cells out because it's like a web
Yeah, it's gone.
It's gone in several different directions, and it
Right.
hasn't been encapsulated in like the organic cell, isn't it?
Yes, that's why
Isn't
the lower the number, the lower the G, you're better off.
Because it hasn't gone outside of the borders of like
Right.
the kidney or whatever. So
Right.
you can just take the kidney out as opposed to it.
Not going into your ureters and your bladder.
Okay.
But sometimes, I think I understand, but sometimes they don't know until they open up a person.
Correct.
And they look and the cancer has spread everywhere. So then they'll just close them back up and hope for the best. Maybe give them palliative chemo or radiation. But even if the G is lower, Professor Denson may be headed in this direction. Anytime you take out anything that's cancerous, there's this phenomenon called seeding, which means as you're excising that tumor or surrounding tissues, that those cells that we cannot see have the tendency to spread into the surrounding tissues or surrounding organs. Right, which is why they go ahead and the radiation to hopefully kill those cells. That's something that cannot be helped. You just know that that's a possibility.
So that's why they do several needle biopsies
Yes.
because they can't really see where.
What about
The
that
cancer.
whole 10-year rule though? Once you, isn't there that 10
5
years?
years.
Yeah.
It depends on what type of cancer it
You're
is.
on the cancer free for so long, but if you got it all, why would you?
Seeds
They
can come
can't
back
see it, they
because
can come back.
seeds that are dormant too.
Yeah.
Okay, I want to say something here that a lot of times you'll see people who do not want surgery for their cancer because they heard, once they open me up on full-blown cancer, because they heard wise tale, but it isn't really a wise tale. Wise tale, myth, that those seeds can go. And some people don't even want chemo after they've had the surgery or radiation. So there is a little bit of truth to some of these myths that it does spread through seed.
Some people are really into the naturopathic methods to cancer. I had a really good friend who she didn't even know she had ovarian cancer. And by the time they found out she had it, she was stage 4. So looking up there, you can see how severe her cancer was. She decided to go the naturopathic route, and she lasted for a year, longer than what the physician told her that she would. But eventually, cancer, she would succumb to cancer. So you have to understand that not everyone is going to do what we expect for them to do, and you have to respect that.
That brings me to, if the still applies to our clinical group, we had a patient in there, she may have been in the hospital a long time.
I don't think any of us had her. Kim was talking about it. Yeah, you were going to take
it.
it.
Yeah. You morbid. Anyway, this is a 50-year-old. He had grown sons, and they were living out in the desert in a tent. She had been diagnosed with cancer, could not make her medical treatment. From what I'm hearing, the cost occurred where they lost their home, and some other things were going on with her too. But I couldn't put my pinpoint it. But she was a rapid growing cancer. She stayed in the hospital a long time. When she died, her sons and no one came. She ended up in the morgue, and generally in the state of Arizona, the state's gonna have to put her away. Her sons have no money. But it's funny that they said they didn't have money, but they had cigarettes, they had snacks, all these things, but who knows? But they lived in a tent in the desert. Can you imagine the living conditions? She has cancer, but what's that?
I think they had like kind of like not a cult, but a group of people that were out in the desert. His friends did come in right as she was passing, and they smelled of smoke really bad. That they said they lived out in the desert too, so they were gonna go hunt down her son.
She's still in the desert. Okay. It's funny how things they relate to clinical.
I have a question.
Yes.
The GX, the cannot be assessed, is that before or at, like, is that on the good scale or bad scale?
Say it again.
The GX, the grade cannot be assessed, undetermined grade.
It's atypical. You'll put the term atypical. They can undetermined by the ecology as to what's what.
So,
That's one of those, it may be, it might not be, you gotta wait a little while.
no.
Yes. Matter of fact, that segue is sometimes one physician will say, you don't have cancer. Within a month or two, they go to another physician, the cells have grown, and that physician says you have cancer. So the person wants to sue the first physician, but it's not really his or her fault.
But in the reality, like, a month has gone by, there could have been major growth, right?
That's exactly. Okay. Just know that. But this one, you see a lot. Tumor nodal metastasis. It's either tumor, it's gone into the lymph nodes, and has a metastasis. Is there a metastasis? No. Okay. TX, here again, they can't differentiate. TO, no evidence of tumor. In situ, it's localized. Not spread. T1, 2, 3, 4 is just increasing in size. Nodal, they can't determine if it's tumor. NO is no regional nodal metastasis, and in 1, 2, and 3 is the degree that it's in the lymphatic system. The lymph node. In X, they can't determine if it's Mets yet, if there's metastasis. MO, no distance metastasis, they'll take biopsies of different areas. In MI, distant metastasis. That's like, for instance, someone may have had surgery on the abdomen, which is non-gynecological, and through the bloodstream and the lymphatic system, those seed cells have metastasized to the ovaries, the uterus, and spread. An example of this. Breast cancer, T3, N2, MO. That refers to a large tumor that is spread outside the breast to nearby lymph nodes, but not in other parts of the body. Let me give you an example of that. What's that mean? Small tumor has not in the lymph nodes, has not metastasized. Give you another one.
So will you see this in charting, or is this
You'll see it on the results of this, the
pathology?
pathology. Did I? Very large tumor. It's midway in the lymphatic system. It's metastasized somewhere. Okay. They extend.
Okay, so like goes from 1 to 4.
On the T, it goes all the way to 4. And the others, like I said, it's on this slide.
Oh, I see. Okay.
If this was 2, you know that person has a rapidly, it's only 1. But someone could have M2, and they've been in hospital about ready, if they've not got any
So it's
treatment.
all over.
So is M1 like to another organ system, and then 2 is like multiple organ systems?
M2, it's probably metastasized.
Like
Say it what was in the lungs, it may have gone to the breast, and it may have even gone down to the diaphragm and to the
oh,
I will kind of look at this, okay? And you will have some examples with that. Okay. Another one would be like the prostate. A tumor 2, N0MO. They have a large, medium-sized tumor. What if it said, let's see if you guys can catch this. Someone has been having prostatic changes and problems. They are in outpatient testing. They're doing a biopsy, and it's TO, NO, MO. What type of tumor do they have? Benign. But if it was benign, would they take it out?
Yeah, maybe.
If it's interfering with urinary?
I don't know, my biology professor, she said if you ever have anything benign anywhere in your body, you should get that removed.
Because it's going to interfere with normal functioning. It can impede neural, or say if it's urinary, it's going to impede urinary flow, because it's going to cause some changes. We know that, genetic speaking, when you hear the term carcinogen, all that's saying you have a gene that is associated with that cancer progression. There are chemical carcinogens, and you talked about it. There's of the lungs, there's asbestos, there's pesticides. What if you lived in an area, which we do, where they don't spray crops? Why would someone get cancer airborne? In other words, they crop dusted over the years. The soil or the water.
I read somewhere that house plants also can let off, I forgot the name, but they let off something that causes cancer in people.
House plants?
I think
everything
Yeah.
causes cancer.
Yes, they're using soil, being it genetics, that synthetic soil, whatever you buy at Walmart, whatever. The thing, it could have some of those carcinogenic changes. Physical carcinogenics, like hormonal, you have radiation that can exposure, intense exposure to radiation. Chronic irritation, like we talked about. Someone has ulcerative changes, some erosion. Individuals, another type of individual who is prone to cancer can cause a mutation in the gene. Your diabetics, which heal slowly, and they have other comorbidities with circulatory problems, with that chronic erosion and the slow healing, that's a precursor to cancer cells developing. Okay, we already talked about dietary factors. Nitrates, high nitrates in the diet. High lipids, cholesterol. Why would starch be a problem? Because it increases sugars, which causes sugar is, you have too much excess of starch, sugar. There's the high incidence of maintaining weight gain, which has its own problems associated with other disorders, hypertension, cardiac disorders. Personal factors, like I said, someone has increased sexual activity, they may have HPV, other STDs, STIs also. For that, it's modifiable, the person may not want to modify it. Immune factors, the person's immune system is delayed or impeded. Age, think of an elderly person who has smoked for years. And they say, I've never had a problem, I'm not going to develop anything. And so, how can you tell me that? And you know the immune system decreases with age, correct? You have someone who has a decreased immune system, and say they're hospitalized, and they need to be treated with corticosteroids. And they're on medications that may interfere even further, other than the corticosteroids, with causing blood dyscrasias or problems. This person, all these years, has smoked, never had a problem. They get hospitalized with a comorbidity, something going on, and they develop cancer. Because the immune system is reduced, and there's other additives to the picture. Then at this late age, that's when they have cancer. And genetic factors, like I talked about with BRCA1, BRCA2. What do we do to prevent cancer? If it is, let's say it's from the rays of the sun, what could you tell the person to do to minimize their effects of acquiring skin cancer? Sunscreens, sunblock, wear hats, long sleeves. Oh, don't live there, another one, we don't live here. What would you tell them, what time of the day would you minimize your report? When the sun is really hot, where you have those rays on you.
6 to 6.
Yeah. Just minimize, in other words, you want to go outside. Okay, you want to minimize your exposure when the sun is most intense. Okay, let's go to, let's see. Someone you're trying to prevent oral cancer. What's usually the correlated factor? Tobacco. Chewing, dipping, smoking. It's modifiable. Huh? They're all modifiable. By the way, the hospital goes non-smoking pretty quick. So
April 1st.
April 1st, April Fool's Day. It's not. Okay, let's talk about throat cancer. Same thing. Oral and throat cancer is from the cigarettes. And STIs. Because why, Miss Miranda? You're right. All the above activities that people do, young and old, which predisposes them to infestations that then erode the mucosal lining of the mouth and then into so how would you refer to people, the ones, say to teenagers? We can refer to
Their mother.
Okay, parents, who else? What type of nursing group, in generic group? Community health nurses?
Yeah.
The county, send them to the county? they're not gonna listen to you, so the county gives out a lot of freebies, a lot of information. Community health nurses,
I think kids in their teenage years who smoke should be sent to the hospital to take care of cancer patients. You know what I
They should
mean?
have a day in hospice.
Yeah. So they
Just
know.
comment on that. What, I believe way back when I was working at, before the new hospital was built, we thought we could scare them straight, So we invited some teenagers to do summer work, volunteering, and they did a little presentation on it. One of the physicians presented, and then afterwards the students had to sign up permission, and they knew about confidentiality. And they went to some of these people who had cancer, because we had different types of GYN and oral cancer, all this stuff. For the moment, it scared them. But what do we know about teenagers? They think it's not going to happen to them. So they keep on with their other habits after a while. I think we need to have a daily come to Jesus there. Okay. We already talked about throat. Lung cancer, that's exposure to not only tobacco-based, but asbestos. So what would they do in their home? Who would they have? If your home was built at an earlier year, what would they have? Some type of inspection of your home. Okay. Now, moving on down, breast cancer. What are some preventative things we would have the female do? BSE, breast self-exams. How would you tell her to do it and when?
Every year.
Did someone say a year?
Well, I mean, like,
Once a month.
your year.
You can have a breast check.
The self-exam.
Every month.
It's every month.
Every month in the
Okay,
shower.
one time in
When
the
you're
shower.
not on your period.
So it's gonna be after. Say it again, say it loud. You may say it again.
When you're not on your period. Because it causes
Hormonal change. Okay, Jamie, say it so everyone can hear it.
when you're not on your period and monthly. Shower.
And, you wanna avoid those hormonal. Okay. In your book, it has an example. Do they just have pattern fill on themselves? What do they do?
Well,
Wait, someone come over here. How do they do it? How do they
Alright,
do
so
it?
you
Hi,
go
Rob.
like this. So we had it last semester, you do circular motions, moving around,
And you're going under the arm.
under the arm for your lymph nodes, around here,
And including the nipple.
and then you pinch the nipple.
Okay. That goes for females and males.
There's
Males
5%
tend
of breast cancer are males.
females
Turns out the project.
So don't take,
It's down in the class.
so don't take Tagamet because
All
you'll
right.
get
Got it.
acidic.
Let's go the other end of the spectrum. What if
And
it's
how do you
not?
remember that?
First of all, I want to know TSC, testicular self-exam. And number 2, when would they do it? And number 3, what age should it begin? Okay, let's go with what should they do?
Puberty, probably.
With onset of puberty. That's a teachable moment. What else? What else do you say? When would they do it?
So there's a couple of things that I've read. It's that now they're getting away from not doing it monthly, but like every couple months. Which I wasn't sure why you wouldn't do it monthly, but because I've had 2 friends who've had testicular
It's
cancer.
best if you're gonna do something, do it monthly. You have a
But
pattern.
it was like, and I'm like, how did you let it go that long and
Yes.
not know
Yes.
what's going down there?
So it's after shower too. shower is monthly. The onset baby puberty, because that's a teachable moment for other things. Okay. And I'm not going to have anyone demonstrate or say how you do it. You just need to say that you need to cover the whole testicular area. The lymphatic drainage, the scrotal area, total scrotal area, and even underneath. So you may have to teach that to somebody. Okay. What do we do? What age group? We said it earlier. For men, prostatic. What preventative measures do we have them do? What exam should they have? Okay. Prostate exam. Is that a comfortable thing? Someone tell me what they do with a prostate exam.
They go in the food.
Or would you please share with us how a prostatic exam
Rectal exam.
It's a rectal exam.
Yeah.
And when should it be done? What age group on it?
Or whenever they feel ready.
Don't they do the
Okay.
PSAs now? Most.
They do PSA,
Okay.
prostatic. But keep in mind, they do it's in PSA, the anti-prostatic.
They're
Yeah.
confusing
It's kinda like
TSA with
piercing
TSA.
I don't know what you know.
Okay,
Yeah.
TSA is a testicular self-exam that or are we talking about TSA as in the people at the airport? TSA, people at the airport. They should not be doing TSE or PSA, none of that. PSA is your prostate specific antigen,
Yes.
or it could be a public service announcement.
I thought it was prostate self-exam.
Every time it works. Okay. So it can be blood test, or they can, in conjunction with, they can do the digital exam. Okay.
Not on themselves. I don't even want to think about that right now.
Yeah.
Took it there.
Wait, what? Somebody do it? Okay.
They start at
40?
40?
no.
30?
They start young. It's part of their yearly.
I've never been there.
You never have one?
The age is going
Okay,
down
up it.
because it's
After you do, just
a
continue saying you never have.
I've never had a PSA on my blood.
young ones, usually about 40 to 50.
I'm not.
In the 4 o'clock. Oh, you're talking about yourself. TMI.
Well, no, but I mean, it's a blood test. It's not like.
Right. That's what I thought. What you just say? Say it again.
The 4 o'clock teaching presentation thing at the health fair, they were saying that it's the #1 cause of cancer for 15 to 35-year-old boys.
For what?
So
What?
they
What
get
is?
Testicular.
The
No.
testicular.
Yeah.
testicular, yes.
Oh.
That's why they say start.
So
Yeah, that's
differentiate
strange.
testicular from prostate.
That's a great.
I think
What is
that's
a testicular?
great.
They had to
Yeah.
do blue
You
flags
just
for
like
that job.
roll your finger around. You can leave it.
Okay.
I'm not gonna.
You jump.
Can you do that again?
Okay. So anyway, we talked about prevention relative to
This is getting way
prevention. We talked about prevention relative to dietary changes. We talked about relative to breast changes relative to cancer. We've talked about testicular and prostatic and cervical and uterine and ovarian.
What's the test that they do for cervical? How do they diagnose uterine? I mean ovarian.
The cold ultrasound. They do the cell scraping.
That's one of the ones that doesn't get diagnosed for a while.
There you go.
Because you're asymptomatic.
Ovarian does it?
Ovarian.
Not until it's bad.
but how would you ever-
It's asymptomatic.
Right. Usually they find it the person is complaining of like GI symptoms, bloating, lower abdominal. They usually kind of go over the person's head, and then if they continue, they may do an ultrasound, and then they'll find it that way. But there's really no at this point clear cut test that you can do strictly for ovarian.
The cervical and invasion into the uterus, you have to yearly pass. When would you start a young woman having their pass?
16?
Sexually active and it's getting lower in age. But a parent may not know when their child is sexually active. So what would you think you do?
You ready?
When they start their menses period. Okay. Yeah. And
Traumatizing.
Oh, yeah.
I would say puberty because some children,
My mom
some
took me at
children
16.
are not going to tell you. Some won't even tell you when they begin the period. So, hey. And gene therapy, you want people to go to genetic counseling relative to gene therapy to determine if they can do diagnostic testing, and then there's the counseling related to it. Okay, one more slide. When you think of cancer or the possibility of cancer, you need to use these caution. Caution. Is there been any changes in bowel or bladder habits? Be it frequency or the character of the stool. That's in someone starts having uncontrolled, intractable, meaning can't control it, diarrhea, or where they become so constipated where they can't go at all. That's called obstipation. Okay, so there's changes in bowel or bladder habits. It can be a change in the form of the stool. Now, most people aren't going to be looking at the form of their stool. But if something goes from where a person has soft stool to where now that it's more of a narrowing of the morphology of the stool. Okay. A sore does not heal, which we talked about. Unusual bleeding or discharge. Example of this would be a woman who thought she was over her menses, and all of a sudden she turns 60 or so, and she starts having dysfunctional uterine bleeding. They determine that. Or discharge. Remember we talked about mammograms, but you want the person to do their self-exams. If there's discharge from the nipples and it's not related to lactation or anything else, that could be a correlation to having cancer. Thickening or lump in the breast or elsewhere. That's why you need to do it the same time during the month after the menses, where there's not that hormonal involvement where you feel a lump or thickening. Sometimes, I'm going to say this, sometimes if it's a husband-wife or it's girlfriend-boyfriend, it's not the person who has the cancer that finds it. Someone will say, what's that on you? Or they'll feel and they'll say, you need to have that checked out. Because if your spouse or significant other is very attentive to you, they're going to find that. Okay. Listen to them with that. Okay. Indigestion or difficulty swallowing where it's not responding to pharmacological management. They do endoscopic type diagnostics, and no matter what kind of medications they use, the person's not responding well. They do subsequent scans, and they can't find what really would have caused the thing, and then they do a biopsy. They could have did it with the endoscopy, and they find tissue that is atypical, you know, and we'll see how it can feel that they determine it. Obvious change in wart or mold. Where the borders are irregular borders are correlated, and there's different pigmentation in the mold. That's the correlation in cancer. Nagging cough or hoarseness, where you've not been singing in church and got hoarse. You just all observe something got hoarse. And like I said, a hacking cough where there's some irritation. Okay. Let's take a break for about 10 minutes.